Okay, so for the next question is actually all around CCF. CCF is what? Congestive cardiac failure. So the next question is just all around congestive cardiac failure. So we'll quickly talk about the congestive cardiac failure. So they said at least 5 causes of congestive cardiac failure. Then also outline the management of congestive cardiac failures in infants. You know, this is pediatric, so we're not talking about the big guys. We're talking about the babies. So congestive cardiac failure. So talking about the 5 causes, like what could make the heart of a baby want to fall or a child want to fail rather. We have things like what? The ventricular septal defects. We have the patent ductus arteriosus. All these are congenital heart defects, right? Then we have the atrioventricular septal defects. We have obstructive lesions. We have coarctation of the aorta. We have aortic stenosis. Okay, so this is even 6. Okay, so everything I listed here was basically classified under what? Left to right shunts. I'm giving you guys many. Okay, talking about the causes, the discuss is based on classification. Do you understand? So everything I listed here was what? Left to right shunts. They can also have myocardial diseases like myocarditis, cardiomyopathy, severe anemia. Okay, high output cardiac failure due to reduced oxygen carrying capacity, arrhythmias, then supraventricular tachycardia. I don't really understand. Okay, how I actually answered this question was this. I gave the 2 classifications. So from the 2 classifications, you can pick out any 5 causes. I don't know if you understand. So over 10 causes, so you just pick out any 5 and work with it. So what's the management? Management is, first of all, the child is in distress, so you are trying to stabilize. You are trying to relieve the symptoms. You are trying to treat any underlying cause. So general supportive measures is oxygen therapy, because the oxygen levels are actually going down. Okay, so optimize their nutrition too. Okay, maintain normothermia, so their body temperatures, you make sure that it doesn't go down. Okay, so for the nutrition is small frequent feeds. Okay, so food. Okay, sometimes you put in the NG tube, that's a nasal gastric tube. The pharmacological treatments, you give diuretics like furosemide just to reduce the fluid levels in the body. You give the angiotensin converting enzymes, inhibitors like captopril. Then you also give digoxin. That's if the heart is not pumping well, digoxin will help it to actually what? Retain its contractility again. So treat underlying cause. If it is anemia, we correct it. If it is infections, you correct the infections. Then if it is congenital heart defects, then you have to surgically correct it, okay, or intervene. So you keep monitoring and following up, where you do regular assessment of weight, feeding tolerance and growth. Okay, monitor electrolytes and renal function. Okay, because you are giving diuretics and all of that, so you don't want the drugs to actually disbalance the body.